Well, good afternoon, good morning if you are joining us from Australia. Welcome, please come on in, make yourselves at home by using something we're very familiar with at this point, which is the chat feature at the bottom of your Zoom screen. Please let us know your name, the organization that you represent, where you're coming from today, and let us know your personal favorite spot outside to take a mental health break. My name is Christian Beckwith. I'm the director of SHIFT. We're a 501c3 based out of Jackson, Wyoming, that advances nature as a social determinant of health. And so this is our SHIFT Health and Nature webinar series. And with it, we explore the health and nature movement from the perspective of our various stakeholder groups. So today's episode marks the end of our land management chapter, in which we've been looking at the intersection of land use and public health. I would like to thank, as always, our sponsors, the National Park Service and All Trails. My backdrop right now is Grand Teton National Park, which is currently experiencing more visitors than we've ever experienced in the history of the park. So if you're one of those, I assume you already have your All Trails app at your side and you're using it to navigate the park's beautiful trails. If not, All Trails is another one of our sponsors. We're really excited about that. We encourage you to use the app to discover the glories of Grand Teton National Park and the greater Yellowstone ecosystem. So thank you both to the National Park Service and to All Trails for your assistance in making this series possible. And with today's episode, we are looking at the mental health benefits of parks. According to a report that was authored in 2019 by a team of ecologists, psychologists, and economists from Griffith University in Australia, visits to national parks worldwide create mental health benefits valued at $6 trillion US per year. Trillion is still a large amount of money, even in this age. So we're really excited today to have the author of that report, Dr. Ralf Buckley, with us, as well as Jon Jarvis, who from 2009 to 2017 was the director of the National Park Service, and Brenda Schmidt, the founder of Solera Health, about how such economic quantifications of park benefits can be used to advocate for parks in particular and nature as a public health intervention strategy in general. So, Dr. Buckley is Emeritus Professor of Ecotourism at Griffith University in Australia. He works on conservation, especially nature and health. He's having his tea as he's waking up this morning. So thank you for joining us. And we also have with us Jon Jarvis, who is the Executive Director of UC Berkeley's Institute for Parks, People, and Diversity. He did serve as the 18th director of the U.S. National Park Service. He's a career civil servant, and he's been with the service for more than 30 years, including 10 years as the superintendent of Mount Rainier National Park, Craters of the Moon National Monument and Preserve, and Wrangell St. Elias National Park and Preserve. He's also the author of the book, Future of Conservation in America, a chart for rough water. With us as well is our very own advisory council member, Brenda Schmidt. She's a serial entrepreneur, a speaker, an educator, and CEO of Coplex, a startup studio that partners with corporations to build businesses to create a better future. She's a builder focused on driving innovation through technology with a particular interest in social impact, and she is deeply embedded in the startup ecosystem. She's a mentor, advisor, and entrepreneur in residence to several accelerators and emerging digital health startups. She also serves on the boards of the Startup Arizona Foundation, Solera Health, RexPay, the Arizona Bioindustry Association, the City of Phoenix Workforce Development Board, and is a Fierce Health editorial board advisor. So thank you all for joining us here today for this very important discussion. Folks, if you're joining us, we are recording this for later distribution on our Slack channel at Shift Nature Health and on our YouTube channel, so we'll post that once the conversation has been finished. You can be part of this conversation as well. So there is a Q&A feature at the bottom of your screen. Use it for any questions that you have for the panelists, and we'll get to those in about half an hour after we've begun the conversation directly with them. With your Q&A, if you could include your names, titles, and the organizations you represent, that would be wonderful. So, Dr. Buckley, we are so curious, how did you come up with a figure of $6 trillion a year for the mental health benefits of visitation to parks worldwide?
Well, around the world, governments collect statistics on the economic costs of poor mental health, which are not only healthcare, but lost economic productivity. And those amount to about 10% of global GNP. And of course, we have lots of research and our own experience that shows that spending time outdoors in nature in national parks is good for your mental health. So we just put those two together. We argued that if there were no parks, then the cost of mental health would be higher. And if we could calculate how much higher, that would give us an economic value for national parks in addition to all other economic and non-economic values. But to do that, you need quite a lot of data. And so for 20,000 people throughout Australia, we collected information on their recent and lifelong history of parks use, on their mental health using 6 clinical psychological scales, on their health care costs, so number of visits to psychiatrists, psychologists, doctors, and also their workplace performance, and also on demographics, socioeconomic, physical health, fitness, exercise, use of other green space, and so on. So everything that might affect their mental health. And then we used a standard economic tool that governments already use to allocate their healthcare budgets to connect those together. And then that gave us a figure for Australia. And then we extrapolated worldwide using 5 or 6 different techniques, and we chose the most conservative of those. And that's where the figure of 6 trillion came from. So, and that figure has been accepted by the World Health Organization, IUCN, and so on. So it doesn't seem to be under dispute. And obviously it's quite a substantial figure. It's about 8% of global GNP, which makes it 10 times larger than global park tourism revenue, and about 500 times larger than the aggregate budgets of all the national park services in the world. But it is an ecosystem services value. So it is a subsidy from nature to the human economy. And of course, what national parks services need is cash flow. They need a transfer of money from other bits of the economy into the conservation sector. And to achieve that, we have to look at how different countries fund healthcare. And it's different in every country, but they use combinations of the individual patient, government, charities in some countries, and of course, health insurance. If we look at the USA, more than half the population gets their primary health care from employer-funded insurance. So the question is, would those insurers pay for nature therapists for people to go visit national parks? And historically, of course, the answer was no, but currently the answer does seem to be, in some cases, yes. And Brenda is the person that made that happen, and she'll tell us how. But of course, there is another question, which is, does that money go to the National Park Service? And the answer at the moment is no, it does not. But it could if the Park Service acted as a healthcare provider. And it turns out that actually it can do that. And Jon is the person to tell us about that. So over to you guys.
Well, and Jon, that would be your cue. You know, you were instrumental in bringing public health into the National Park Service. I wonder if you can tell us a little bit about that journey, and then any observations that you might have on how the Park Service and other agencies might use Dr. Buckley's report.
Well, thanks, and thanks everybody for joining this webinar, and thanks Ralf for your great work, and Brenda for your great innovation to bring this to reality. So I was introduced to the concept of nature and health as an opportunity to work together, really from Australia, some friends down there that are park managers that I met with well over a decade ago to start this effort where parks become part of the public health infrastructure. And I experimented a lot with it as the regional director here in California, working with the California State Park System at the time. And then when I became the director in 2009 of the entire National Park System, I realized we had an opportunity to really engage the Public Health Service. The Public Health Service has been embedded in the National Park Service for almost 100 years as a partner organization, but their focus has been in the past predominantly public health, water, potable water, food systems, and even sort of an epidemiological monitoring system for these, visitor populations that might bring a Legionnaire's disease or a hantavirus outbreak in the national parks. What I saw as an opportunity to really engage the public health service in something around this concept of nature being literally good for you. And so the concept of One Health or Healthy Parks, Healthy People was something we could really run with. And so we built it into the centennial as one of our objectives, and to find and help facilitate at least 50 medical doctors around the country that would begin to prescribe national parks as part of their medical practice. And that has really grown, I think, quite exponentially around the country with all kinds of innovation around asking the public to go to nature as an antidote to many of the ailments that they might have, whether it's obesity or heart disease, depression. And it really requires, on the public land management side, that's not just the National Park Service, but state parks, county parks, U.S. Forest Service, all of our land management agencies, to be ready to receive the public for those benefits. And I think that's equally as challenging at times, because they're all chronically underfunded already, and in some cases already overwhelmed with visitors. We're well over 300 million visitors to the national parks now. So it really is going to need to be some kind of partnership out there, working with nonprofit organizations, for-profit organizations, and others to really provide the kind of mental health, physical health, public health benefits that parks can provide. But to me, it's a paradigm shift, because it raises the importance. We already know parks are important from a tourism standpoint. We know them from some ecosystem services. We're beginning to understand their role in carbon sequestration. It's certainly important in rural economies. But to add this incredibly powerful public health benefit and its economic consequences could be a significant shift in the importance of advocacy for and the protection of our parks and protected areas.
Great. Okay, and Brenda, we're going to let you take it home here for us.
Yeah, I thank you. No, I've spent my entire year in health, or entire year, it feels like a year, entire career in healthcare. And I think, what I've really tried to do is align the incentives around ultimately the outcome with the payment incentives in healthcare, which there's so many misalignments. And so, healthcare happens in doctors' offices, but health really happens in the 99% of the time we spend where we live, work, play, pray, and shop. And nature is a huge part of that, but the healthcare system has never been set up to actually pay for things that happen outside of clinical settings. And the exciting thing for me, and one of the early reasons that I started Solera, was there was finally a business model for actually paying for services delivered through non-clinical services when the Centers for Medicare and Medicaid Innovation decided to reimburse for the diabetes prevention program. And for those of you who are not familiar with that, it's actually an evidence-based program delivered by lay health workers with no credential, no certification, no, just I always say two people in a church that are teaching people how to be healthy. And it was the first time that, because of the Affordable Care Act, that health plans and employers were required to pay for something that was not delivered in healthcare. And it really, I had the hope, and I think it had the promise of leading to paying for other things that were not clinical, outside of clinical settings. And so, Christian and I started talking last year around how could we take the diabetes prevention program, which is now a reimbursed covered benefit for 30 to 50% of all Americans, and use that as a model to have this intervention more specifically be delivered in national parks or other parks, city parks, just outside in nature and have a funding mechanism from the health plans, and employers pay for that. And that funding mechanism is already established. But then what was always also exciting to me was this whole movement around the recognition that social determinants of health have such a huge impact on people's health outcomes. And as that discussion was really evolving, it was around isolation and loneliness, certainly food insecurity, transportation, housing. But because the evidence is really there around the cost benefit of time in nature, the evidence for time in nature is actually much more compelling than even things like social isolation and loneliness. And so how can we package up time in nature as a social determinant that is part of the supplemental benefits that the health plans are starting to pay for, as we're thinking about others of these social determinants of health? And how do people in parks or people employed by parks actually become part of that healthcare delivery network to be able to be not only referred to, but ultimately deliver that care and have a reimbursement mechanism through health plans? So that's where I'm really excited and focused, because all of these things, there isn't a single siloed intervention. Certainly mental health is in 70% of the cases a comorbidity for chronic health conditions like heart disease and diabetes. And certainly social isolation and loneliness has a huge contributor to poor health outcomes. And I think some of these interventions that can be delivered in parks, even beyond Ralph's study around just time spent in nature, just have a compounding benefit of the opportunity to significantly improve the health outcomes and costs of people who may visit parks.
Thank you. And I'm just so curious, you've got such a dynamic mind. Where does it go when you see something like Ralph's study? What are the opportunities it opens up?
No, I mean, I think what I love about Ralph's study is, for those of you who are in healthcare, we need a soundbite. For those of you who are in healthcare, there's a huge movement now around social isolation and loneliness. And everywhere I go, they'll say, social isolation takes 15 years off your life, and it's like smoking 15 cigarettes a day. I don't know where that study came from. I don't know who published that study, but everybody cites that as evidence for why health plans should be reimbursing people for interventions that address social isolation. And they're for everything like a digital network of clubs to social circles within your neighborhood. And these things are getting, PAPA is a intervention that's getting a lot of traction, where you sort of hire a fake grandkid, if you will, but that's like 10 hours a month for a senior that a health plan is paying for to address social isolation. And the evidence isn't nearly as strong as the evidence that Ralf has in his study. And so I think the opportunity to take that study and really try to socialize the benefits of saying, if you're spending 10 hours a week paying for someone to address social isolation, let's move that into an area where there might be even the opportunity to address the social isolation in a place that we also know has an impact on mental health. The other area that I see is folks and employers especially will pay for gym memberships. They'll pay $25, $30 a month for a gym membership, and yet they're not thinking about, I'm going to pay for a park membership or a park fee or some mechanism to actually get you into that, into nature. The other thing that I think about a lot, and another business that I'm starting, is the Affordable Care Act really had the promise of going upstream and helping people become more healthy. And so they put in the requirement that anything that the U.S. Preventative Services Task Force deemed a grade A or grade B intervention, which means that there was evidence for effectiveness, had to be covered. It was mandated that it was covered as a benefit. And so that's really what's fueled the traction around diabetes prevention, obesity management, some of those things. That infrastructure is in place. And so, but from a health plan, if they're only keeping that person under their health insurance in the United States health insurance system for 19 months, in Medicaid it's less than that, then there's not really any incentive for them to go upstream and pay. So we're trying to create an infrastructure by where the health plans will pay into a fund that would create opportunities for city parks or other opportunities in nature. And then as people got healthier and they were healthy people, they would get a return on that investment through an actual payment. Like, what doesn't exist in this country is a funding mechanism to incentivize people paying for healthcare, to pay for things that have really long-term return horizons, and nature and some of those other things definitely are not within that, typically 12 to 14 months. So there's lots of opportunities for, I think, novel business models to try to align the payer incentives and get some of these things paid for.
That's great. And Jon, you've used economic arguments in the past with parks. How do you marry what you've been hearing from Brenda with what we understand from Ralf's study?
Yeah, I think a friend of ours said that whoever makes the economic argument first wins. And we use the economic argument over and over again in the National Park Service to justify and build support for appropriations for funding of the national parks. And basically, we ran the economics and know strongly that for every dollar invested in the national parks, there's $4 into the economy. But that's all touristic economic benefit. That's people spending money when they travel to go to national parks. And I think by expanding the economic benefit, you make a stronger argument that these are worth investing in. I always say that the national parks are not a cost to the federal government, they are an investment because there's so many returns. And I think we've been generally inarticulate about the multiple benefits that come from national parks beside this sort of classic tourism values. And I want to make a really other strong point here is that there is an inequity in the availability of nature across the nation. We have our national parks and we have our national forests, we have our broad federal public lands, but in many urban environments, particularly in communities of color, there is a lack of the outdoors. And I think that particular point was honed most appropriately and most strongly during the COVID pandemic. And so I think if we built something, as Brenda suggested, I think one of the investments would be to build nature near home. I think where you're going to get multiple benefits by repeated exposures that are close to home. National parks clearly can be part of that ecosystem, but we need to look at them really where they will provide the most benefit to the most people, particularly in these park deficient communities.
Mm-hmm.
Yeah, thank you.
Yeah. One of the, Peter Mayfield, which is part of the SHIFT community here, has established a program up in Northern California where he's taken really high risk youth with mental health issues and just taken them in nature. And he has been successful in getting Medicaid reimbursement in the state of California for his efforts because he's been able to show that his program, even at I think $10,000 an individual, is significantly less than the alternative, which is traditional mental health, institutional, for some short period of time, or hospitalization of those kids. And so it's those kinds of real world health benefits that can start to spread that to really show, hey, just getting kids out in nature has a significant positive impact on their health, but also on their costs. Unfortunately, it does become an economic argument. We just have to figure out the right economic argument to align the incentives to have folks want to really lean in to something that is for all of us an intuitive benefit.
So Ralf, with this conversation, we're talking a lot about the returns, and I'm curious what you would say about the ways you could envision the public health argument benefiting parks and conservation agencies.
One of the interesting things in this conversation, including Jon and Brenda, is that I come from a science background. And so, of course, once we had shown that there was this overall large-scale economic ecosystem service, we immediately started going, okay, how can we break this up? How can we measure what the individual benefits are for the individual people? How does it depend on the nature experience? How does it depend on the person's history and personality? So a clinical kind of model. And why Brenda's model, the Solera model, has been so successful is that she ignored all of that. She just said, let's look at a milestone that shows that an individual person, a patient, if you like, has improved their health by a certain amount. And once they have, we'll pay. And that basically bypassed all of, I thought we were going to be doing years of research before we could implement this, And then I look and I see that Brenda's already done it. And I'm like, because of the entrepreneurial approach, you know, the business model approach that you mentioned. And then I was going, oh, well, okay, well, that's all good, but, you know, it's going to take years and years before the Park Service can pick this up. And then I hear from Jon, oh, actually, we already have an Office for Public Health. We can do it tomorrow. And so I'm super enthusiastic about the idea that the US National Park Service itself could simply be a nature therapy provider, parallel to the models that Brenda already has. And so I've looked at, so Brenda didn't mention, but the main insurer involved is a Blue Cross group. And I've looked at what they pay for, and they paid for a series of interventions. So I won't steal Brenda's thunder here, but, you know, it's not just you visit a park once. It's like you have a program of activities weekly for several months and then monthly beyond and so on. So then US National Parks could do that. You know, they could say, and that wouldn't, cockatoos are trying to eat my computer.
I don't think I've ever heard that on a webinar before.
Here's a couple. Anyway, because I'm not paying attention to them. I think that one of the important things, and Christian mentioned this, and I think Jon too, that we still have to maintain equity of access to parks. So parks can't become only, you know, part of the healthcare system, because a lot of people just want to go, and it may or may not improve their mental health, but they're not there as patients. So I think it's important that the National Park Service distinguish programs that it's offering specifically for nature therapy that are reimbursable against just saying, okay, you're just here for the day, fine. That seems to be an important thing. And I think, and I think we should ask Jon to comment on this, but I also think that it's important to make sure that the Park Service does this itself. Because if we look at the nature tourism industry, you know, it was all started off 30 years ago about how it was going to be so good for conservation, but actually that hasn't really happened. You know, if you look at the whole concessionaire system that USNPS and other countries use, that's generated a fair amount of profit for private businesses, but it hasn't really generated much money for conservation. So those are kind of my thoughts at the moment. I think it's a super interesting field, and it's going to change really fast.
So Ralf, for the folks that are listening in, if they're park managers or if they're with nonprofit organizations, how would you suggest that they use your study for their own purposes? How do they leverage your findings to advance their objectives?
Well, I guess I hadn't anticipated that things would move quite so fast. You know, our study was, basically there are two questions. You know, is the health value of visiting national parks big enough to worry about? And then if it is, how do we get some of it? So our study just asked, how big is it? Because if it's little, you know, we don't need to even worry about it. And so our study showed that it is substantial. We can break that down into a value per person per year in different countries. But actually that doesn't matter. What matters now is a mechanism of linking Brenda's payment models to Jon's Office for Public Health within the Park Service. So the fact that, you know, okay, so it's 6 trillion, but it could be anywhere between 5 to 30 trillion, depending on, you know, how you did the numbers. It doesn't matter. All that matters is it's big enough for people to pay attention. And I think Jon mentioned that if you want to improve a park budget, you have to make an economic argument. And I would add, you also have to make a political argument. And one of the things why health is important is people care about their own personal health more than they care about conservation. Conservation is a distributed benefit. Health is your own self, you know. If you die, you care about it. So people will pay more attention to health-related things than they will to conservation-related things.
Yeah, I know, Ralf, and thank you so much for alluding to the Solera model. I'll just sort of share what that exactly is. So Solera, what we were trying to solve for is how does a health plan that has very high technical compliance, regulatory requirements contract with a lay person in the community that has none of that. They're very technologically or operationally unsophisticated. Think 4 people in a church or all of the nonprofits doing really great work in their communities that tend to be grant funded, but they don't speak health plan or payer. And so what we did is we contracted as an organization and a vendor and a provider with the health plan. And then we created a network, a national network of all of these non-clinical services providers in their community. And so what we would do is then find people, refer them out into that network of community organizations, gather the data, and as Ralf alluded, when people were actually hitting outcome milestones, the first few, which was really just, did you show up? Did you just go to the park? But ultimately it was around, weight loss or minutes of physical activity. We would be submitting claims to the health plan, just like a doctor as Solera, and we don't have any doctors, but we're submitting medical claims on behalf of these nonprofit organizations, just like a doctor. Like if they're providing a health benefit, they should be paid in the same way a doctor is being paid. And so the health plan would pay us, we'd pay our provider. So it created an opportunity to all of this sudden not medicalize, but legitimize the good work that people were doing outside of the healthcare system that was actually positively impacting people's health. So what we've been talking about is why can't the National Park Service hire an individual or group of individuals to deliver these interventions that have reimbursement and get paid through that mechanism, not only for diabetes prevention or obesity, but social isolation is now being paid for in many health plans as what they call a special supplemental benefit and some other things. And so is there that opportunity where we could place people in community parks or other outdoors to deliver these things that had reimbursement? Now, in a perfect world, I would love for the health plans just to reimburse for time in nature. Unfortunately, there's no code or mechanism to actually be able to do that yet. So we'll have to kind of piggyback onto something else. I think that's sort of the model that we're thinking of. And then certainly the payment from the government could be above what you're paying. That could be a volunteer, could be, somebody who's retired and they want to make a little money. And then the rest of that could pay for the the conservation around maintaining those areas that are places where this service delivery is being provided.
So this is where it got interesting when we had our conversation last week, I think, and I'd love to get right into it. The practical application of this study and what it could mean in terms of parks and lands everywhere. Jon, help us walk through this. How would you envision this being enacted? Would these visits, would they be self-guided? Would they be a new task for park rangers, a new form of concession? How would we make this work from a Park Service perspective?
Yeah, I think it's pretty workable. I look at the sort of infrastructure partnerships that we currently have in the U.S. National Park System. A lot of the parks have friends groups, friends organizations that have been created mostly to raise philanthropic dollars and sometimes facilitate the volunteer efforts, the docents that come and give of their time in parks. And they tend to be a little bit project focused, a lot on infrastructure, perhaps on program. And I think this is an opportunity for them to rethink or perhaps add an element around health, where they could, if they could create this health benefits kind of service component to their program and get reimbursed through the insurance companies for that service. And that could be a guided service. It could be a particular type of program. So people just sign up for it, show up at Trailhead X, and then there is a person there, probably paid for by the nonprofit, to lead the group, to provide training for people to be able to do this effectively. I frankly don't see in the US system a direct reimbursement to the federal agency for the work. I think that sort of gets in the way of Congress and their responsibilities for appropriations. And I always worry that whenever any money comes directly to the agency, Congress just offsets it. So it's a
Very
zero-sum game, right? So I would rather see it develop as a partnership with a nonprofit. Now you think about this for a second. We've expanded over the years our partnership with education organizations that bring kids or families to parks for their educational opportunities. And it's well documented, well researched that experiential education, the people learn, they retain the information longer. So you've built these residential environmental education programs like Nature Bridge and the North Cascades Institute and Yosemite Institute and others. And you could take that same concept around health and build out a program, even locations that are designed for to accommodate those with disabilities or the elderly or whatever that need special facilities to provide for that health benefit. And I think the private sector could play a very significant role here, right? There would need to be some changes to the concessioners because as Ralf very accurately points out, basically they're set up to provide the profit to corporate, no real return to the agencies. But there is some legislative opportunities there that we built during my tenure that could go for some major reform in this area. But I think we've got to, as we think about this, that it is very ripe. It is an opportunity to make this case. And Ralf is also spot on that if people care about their health and they see this experience as to benefit their personal health, then they're going to want that experience to be quality. And that means they're going to want the park to be taken care of. Mm-hmm. And that could be a two-part role. They can help advocate that Congress does its duty, provides basic appropriations to provide their end of that service and support these kinds of partnerships with other organizations that are actually creating the program side of it as well.
So Brenda, if you had 5 minutes to sketch out a pilot that we could implement in the next what would you do?
You know, I liked what Jon said, as opposed to trying to implement the infrastructure within the National Park Service, partnering with an organization like the YMCA. I mean, the YMCA is really moving from, you know, what I call gym and swim into being a community health hub. They've gotten tremendous funding from the Centers for Disease Control around, you know, cancer survivorship, blood pressure studies, things like that. Certainly some mental health, stress, and then diabetes prevention. Is there a partnership with an organization like that that could put their services in a park? What I'd love to see is the next study is delivering these services that are reimbursed in a non-nature-based location, and then put them in a nature-based location and say, if we could prove that people do better with interventions that are reimbursed in a nature setting, in that you can quantify that differential, then you'd see that nature has an inherent benefit all by itself. So I think that partnering with a nonprofit that already has the infrastructure in place, put those people in a park, share that revenue with the folks in the park to be able to have some type of conservation, and then quantify the measure between the pre, which is no nature, and the post, which is nature, just could help us continue to evolve or just have other benefits. People aren't really, when they're delivering a specific intervention, also delivering any type of mental health assessment, to be able even to kind of expand the benefit around these interventions that we're providing on isolation and mental health, I think would be a good next step.
Christian, can I comment on that?
Sure.
Yeah.
Yes.
There is quite a lot of research that's compared the mental health effects of an exercise program not in nature with the same program in a natural setting, and showing that the natural setting improves mental health beyond the physical health component. But it hasn't been a reimbursable program, as you mentioned, Brett. I would like to add two other things. The first is that people with poor mental health may not go to parks because they're depressed, you know, or because they don't have any experience, because of lifestyle history. Perhaps they this is an area that's been researched in the US particularly, how people of different demographics do or don't visit parks. And so what we found in Australia is that you have to construct what we call social levers. You have to construct systems that encourage disadvantaged people, and not necessarily economically disadvantaged, but people that don't have a history of visiting parks. You have to construct systems that encourage them and hold their hand basically to do that, because they don't have boots, they don't have a parka, they don't know how to read a map, you know, they don't know none of those things. So I think that there's, I guess this is what, you know, this is the social determinant of health side, that you need social systems to get people to take advantage of nature. So that's one thing I think will be an important research area. The other thing is that we are, of course, talking about the US system, and the US National Park Service has a budget 3 times larger than any other national park service in the world. And although it is underfunded, it doesn't do too badly compared to most countries. If you look at a lot of developing countries, in Botswana, for example, 80% of the Park Service income comes from tourism concessions. So only 20% from government. And so anything that can, so I think Jon was saying that in the US, it's more important to construct a political argument for greater Congress funding to the Park Service. And I'm sure that's correct. But in many other countries, it's cash flow that's needed. It's because the park services rely on foreign cash, essentially, for basic conservation functions. And so if they can create models parallel to the Solera model, but adapted to different countries, I think that will be very important for conservation funding in other countries. And not only in developing countries. If we look at the UK, for example, where they have an entirely government-funded medical system, the UK National Health Service has just introduced a new model, which is essentially like a government-operated parallel to the Solera match-up system. Whether it will work or not, we don't know, because it only just started. But they're definitely following, you know, they have the same idea, just very different political systems for implementing it. And if we look at Australia, a large proportion of mental health care is provided by 3 large national charities. And so they are also forming partnerships designed to bring people into parks. So I think what I'm saying is that if we look worldwide, our findings have to be adapted to the different healthcare funding systems in different countries.
Yeah, thank you. Jon, I'm just wondering, I'm always so curious about where we could get this going tomorrow. If you had to choose a park that you could pilot this in, where would you start? And how would you start it?
Well, I think at the moment, a lot of the creativity around these efforts are at in the urban environment with urban park systems, and that they are, you know, the model that you build in El Come doesn't necessarily work. Here in California, they passed a bond a couple of years ago to invest about $750 million in creating parks within park deficient communities. There's a whole advisory group around creating equitable access, and I was very involved along with a colleague, Jenny Mulholland Beers, who worked with the California Outdoor Engagement Coalition to work with nonprofit organizations that each have a piece of the puzzle to create greater access and equity, and I think to nature. And I think that's where innovation is going to occur. And I think particularly around this concept of attracting the public to these places for health benefits. And I think there are some opportunities for the insurance industry and the medical, the public health services, all those, to be investigating that and see what works. Putting some funding behind and figure out where the real best practices are, because then you could scale up. This is, while the National Park Service can play a role, and certainly does play kind of a leadership role amongst the land management agencies on that side of the formula, I think it's really the opportunity for innovation is at the community, city park, regional park level, with activist mayors and governors at the moment to really experiment with this and find out what really works and is sustainable from a funding model, from a a political and advocacy model as well.
Yeah, so I think that's where I would probably go first. Is all of the large health plans have foundations, and I think Aetna a couple of years ago they put at least $2 million into social determinants of health, local demonstration projects, and if you can build up that evidence and show the outcome that that health plan is looking for, then they'll kick it over. But even Humana and their Bold Goal initiative in those, I think 8 or 10 cities where they do that, they're actually looking at improving the health of that entire community through using the Healthy Days survey from the CDC. It's just, a couple of questions. And their goal is to improve the health of the community by 20% over 5 years or something. So looking at those organizations that have a payment mechanism and infrastructure to try to really improve the health of the community is much better than trying to find, I'm going to improve the health of the people I pay for, because it's just such a narrow slice of an entire population. So those would be a couple places that I think I would start, Christian, is some of the health plan foundations and some of the work that Humana is doing at the community level.
Yeah, thank you. We do want to get to some of the questions that we're having come in here. We have one from Ashby Level. And Ralf, this one's for you. What would the social level mention that you mentioned to support underserved communities in accessing nature look like with a Solera model in practice?
I don't think I can answer that question. I think that that's a question for Brenda, because I don't know enough about the mechanisms inside the Solera model. So may I please pass that on to Brenda?
Yeah, a little bit more clarification there in terms of how this would actually work.
The question is, what would the social lever mentioned by Ralf to support underserved communities in accessing nature look like with the Solera model in practice?
Yeah, so I think again, the social lever, we just have to look at, if people talk about the social determinants of health more broadly, it's the condition of where they live and how where they live impacts their health. And if you live in an urban area that doesn't have access to any, not even nature, just outdoors in a meaningful way, it's going to impact your health. And I think from that, I look at it much more from a equity versus equality. We have to try harder to get to the people that need those services the most, as opposed to saying, well, now you're just making it easier for all the people that would have gone there anyway. That's always kind of the argument. So I think in the Solera model, it would very much be partnering with the Medicaid health plans, which tend to be much more local in outreaching to those members and trying to make a difference. And that's why I'm sort of fascinated by the work that Peter's done in terms of really working with those, high-risk Medicaid youth and getting them into nature. So I think from a social lever, it would still have to have a financial benefit to reach those people who are potentially high cost that could benefit from the intervention and plug them into just trying harder to. Then it's like, okay, you're thinking about things like transportation, or, you just have to think about what are all the barriers today for people that aren't experiencing nature, and how do we chop those, how do we address those one by one and make it easier?
Christian, I can add to that from the Australian perspective, because the question was about social levers. And the particular example I was thinking of is an organization called COASTREC, which focuses on mental health of urban and suburban mums in Australian cities. And they have money, but they have no time. And the reason is that there is strong social pressure that they should put their families ahead of themselves in terms of what they do moment to moment during the day. And so what COASTREC did is it constructed a system that gave those women accepted reasons to get out of the house and go hiking with their buddies to improve their own mental health. And we have, and I can tell you all the details if you're interested, but you can look up Beyond Blue, which is the the mental health charity, or Coast Trek. And we've actually done a study to check what was the outcome of that, you know. So the families had essentially given permission for the mum to go and hike around, and did the families benefit as a result? And the answer is yes. You know, happy mum, happy family.
Yeah. Well, and someone mentioned the this concept of a peer group or a leader in the community, and you know, clearly the literature is hugely supportive of peer groups, and especially in mental health. That peer group, lay health group is just a model of adjunctive therapy. And so, you know, could you look at it the other way of placing a peer health leader within a group to take a group to go somewhere? Because a lot of it's fear-based, you know, oh, there's bears, or I don't have, you know, or where can I get hiking shoes? I can't afford hiking shoes. So where's that kind of pool of used shoes people could wear? So I just feel like meeting people where they are and lowering the barrier to getting into nature. I think, you know, most of the people on this call probably don't have those similar kind of barriers that somebody has around just not even knowing, you know, it's a lot of it's fear-based or uncomfortability to know what equipment I need, or all of that. There's just lots of social barriers that I think that we would have to target, and that concept of a peer group or a peer leader in the communities could be really powerful.
Jon, I'm curious where your thoughts are going right now. You've done so much work in this space. What's going through your head?
Well, I think that we in the land management agencies make the same mistake over and over again, is that we talk to ourselves and we talk to the same organizations that really have no history of serving underserved communities. And I think this requires us to reach out and make connections with organizations that are already serving underserved communities for other reasons, particularly for health, but for food insecurity or safety or education services, all those just sort of basic life benefits, and partner with them to find this opportunity to knock down the barriers and create ambassadors to the outdoors, the individuals that are interested in perhaps trying this and being a part of it. And then I think that at the community level, something that I think we're trying to do here in California is in creating nature near home, is to not also create parks in the classic style, rather than instead is to work with the local communities and the local organizations to create the kind of park that they want, and that will serve that community, that will incorporate perhaps active recreation and nature at the same time, and provide multiple benefits. You know, another mutual friend of ours said that his favorite park was one where there was a soccer field and a little bit of coastal wetlands, and his kids could burn off steam on the soccer field and then come over and experience a little bit of nature as they settle down. And that juxtaposition really created sort of the perfect kind of urban wild experience. And I think working with communities at the local level, in my mind, is something that has to be done in order to sort of build this relationship. And I think that once exposed to nature, even at the very small component of it in their communities, then that can lead to the next level of wanting to experience more nature in new places. It becomes a lifelong kind of pursuit, and which may ultimately lead them to a national park. But I don't necessarily think that has to be their first level, where they have to buy a backpack and, you know, eat freeze-dried food. I don't think that's the entry point.
One of the things, Christian, that I so appreciated about the First Shift conference that I went to is I had never been in a room that had, you know, the Nature Conservancy, Land Management, Humana, and Walmart, like all in the same room, because I do think we tend to stay in our silos. And I was fascinated by the really good evidence that had been published around the health benefits and financial benefits of time in nature. But those things weren't being published in the health journals, they would be published in the nature journals. So sort of the nature people were all talking amongst themselves, and the health people were way over here, not ever mentioning anything about nature. And it was the very first time I'd actually been in a room of smart people who really wanted to solve this in a way that it would really require multiple stakeholders from a variety of different sectors in the room to do that.
Yeah, and that's where the real magic happens, is when you have that transsectoral collaboration and mind share. And I always think about it in practical terms. So I'm thinking about Tia Wells. So she's the founder of Backyard Base Camp in Baltimore and the founder of Bliss Meadows. So she found there were 7 acres in the most populous neighborhood in Baltimore. She reclaimed it just to create some green space so that she didn't have to pack her kids up and drive them 30 minutes every time just to see some nature. And so I'm just wondering, like, how would this work for Tia when she's serving her community? You know, she's created a spot where people in the 23,000 person neighborhood that she lives in are able to go and they get food. She teaches bird language. Folks are using it for whatever their own purposes are, say yoga. How would she be sort of a health navigator in this sense? And how might she get reimbursed?
I would probably connect her with Lisa Fitzpatrick, who you know, who is there in Baltimore, and she has developed an app called Grapevine Health to really have peer-to-peer communication to build trusting relationships around underserved populations. And so if it could spread through that around the benefit of what this is, you know, the opportunities that and just events and things like that, if that infrastructure could prove to be valuable and have an outcome in healthcare, it would be reimbursed. But again, I think it's connecting the dots around how to get people aware with the services that are provided with somebody who understands how to actually connect that into the healthcare system. But that's a great example. That's a good place to start. So maybe it's Baltimore, Christian.
I know. It might be our next project to incubate, which I'd really like to.
Yeah.
Well, we're getting down to the end of our conversation here. And I'm just curious if anybody has any last thoughts that they would like to leave participants with.
My last thought is, Brenda mentioned that she already has contacts with the Nature Conservancy. So if Jon thinks that this shouldn't be done initially in US NPS land, I would be saying, well, private conservation reserves worldwide are going to be very, very interested in new funding streams. And so I'm sure Brenda has already mentally constructed a new startup.
Well, I would just encourage everyone. I have no, I'm not a let's make it better. It's like, let's do it differently. Like if you had to start from scratch, what would this look like, and who would the actors be, and how would they actually come together and do this? So, I mean, I think that's the opportunity that we all have, is to say, you know, we have constraints with the current system that we're in, but if we didn't, how would we do it? And how can we start to move that way? Because we just have to do things differently. Otherwise, we're all just going to continue to live in our silos, and we're never going to really figure this out. So I think we're making some progress.
Jon, your closing thoughts?
Yeah, as a lifelong advocate for our park systems, not just in the U.S. but around the world, I'm always looking for ways to articulate the values that parks provide to the public. And we've probably made the tourism value our front and center, but I think that is really only a small part of it. Ralf said that this ecosystem services that parks provide, whether it's watershed, clean air, pollution prevention, absorption. Now we're talking about carbon sequestration and the amount of carbon that is sequestered by our parks and public lands. There are other values that Dr. Bill Meese and Dr. John Lewis did in their book on the America's Best Investment, including the movie sets and all the Star Wars films that were filmed in national parks, and the education values. But I think that the health value is one that we have not really appreciated as much. And I think if we, as Brenda said, legitimize this value that parks provide. And Ralf has certainly put an extraordinary dollar sign on that value, and figure out how to ensure that everyone has their opportunity to gain from that by access to nature. Then that's a paradigm shift. That gives me hope for the future of conservation of our parks and protected areas.
Well, another great conversation and another great project to start working on as soon as we get this year's shift out of the way. I want to thank you all for working with us on today's webinar and joining us with your perspectives and your insights. Such a fascinating topic. For those of us who have joined from elsewhere, we do encourage you to stay connected with the work that we're doing. You can find all of our webinars on our YouTube channel. You can also find them on Figshare, which were created for the research community. And of course, you can continue this conversation on Slack at Shift Nature Health. So our next one coming up, we have on August 25th, the mental health benefits of outdoor recreation. And so this will be with Veronica Menchaca Perez with Outward Bound Adventures, Elise Rylander, the founder of Out There Adventures, and Kristen Walter, who works at the Naval Health Research Center. And then on September 8th, we've got another one on quantifying the healthcare cost savings of outdoor recreation. That's with Senator Brenda Gilmore from the Tennessee State Senate, Leslie Meehan, the director of the Office of Primary Prevention at the Tennessee Department of Health, and Randy Rosenberger, the Associate Dean of the School of Forestry at Oregon State University. So thank you all for joining us. This year's shift will be virtual, October 14th to the 16th, and looking specifically at equity access and the mental health benefits of time outside. We hope that you can join us for that as well. Thank you very much. Stay safe out there, and I hope you have a chance to get outside. Thanks so much.